this video, we are going to look at the uterine prolapse. The uterine prolapse. And we are going to focus on the management of it. So to begin with some questions. So how do you manage in case of, the first question will be in case of the nulliparous. In case of the nulliparous or the congenital prolapse. So in such cases, how do you manage? This is the first question. The second question is in less than 40 years of age, how do you manage? And the third question we want to ask is in case of greater than 60 years and in case of unfit for the surgery. So how do you manage in these cases? Now we'll find out the answers to all these questions and learn a lot more. To begin with, we look at the nulliparous, or the congenital prolapse. So in this case, there is the abdominal sling operations. So there is a abdominal sling operations. So what is abdominal sling operation? This includes the abdominal. So it includes the abdominal wall, cervicopexy, abdominal wall, cervicopexy. Then it also includes the shirokdar, the Shirokkar's abdominal sling. Shirokkar's abdominal sling operation. Next, it also includes the Khana abdominal sling operation. The Khana abdominal sling operation. Next, we look at the pregnancy. So, in terms of the pregnancy and the postnatal period. So, we will look at this in case of pregnancy and the postnatal period. So, in such cases, the treatment will be by the ring pessary. So, this is basically up to 16 weeks. So, 16 weeks of gestation. Next one is, there is the pelvic floor exercise. The pelvic floor exercise. Next, we look at less than 40 years. So, in terms of less than 40 years, there is the Fothergill's repair. The Fothergill's repair. So, here it is nothing but the Manchester operation. And there is also the Shirokdar procedures. The Shirokkar's procedure. Next, we move on to greater than 40 years. So, greater than 40 years, and this is with the completed family. Along with the completed family. So, greater than 40 years in a completed family, we have the vaginal hysterectomy. There is vaginal hysterectomy and also the pelvic floor repair. The pelvic floor, it is repair. Lastly, we move on to a category where it is greater than 60 years. So, in case of greater than 60 years and unfit for surgery. So, here in such case, what we see is there is the Leafots, the Leafot repair. The Leafot repair as well as the colpoclesis. So, they are done if the patient doesn't want to have. So, in case of the patient does not want to have the sexual function. Now we'll move ahead with answering our questions. So we will answer our questions. So the first question we asked was in case of the nulliparous. In case of the nulliparous or the congenital prolapse. So in such cases, what is the treatment? So the treatment is nothing but there is the abdominal. There is an abdominal sling operation. So what does this include? This includes the abdominal wall, cervicopexy, abdominal wall, cervicopexy. Next comes the Shirodkar, the Shirodkar abdominal sling, Shirodkar abdominal sling operation. Lastly, we have the the Khana abdominal sling operation. Next, we look at the age group, that is less than 40 years. So, in terms of less than 40 years, we have the Fothergill repair. The Fothergill repair. So, this is nothing but Manchester. It's the Manchester operation. So, Fothergill's repair or the Shirodkar. The Shirodkar procedure. Then we'll move on to the age group that is greater than 60 years. So, this is nothing but in case of the unfit for the surgery. So, in such cases, it can include the Leafort repair, or the colpoclesis. So, they are basically done in cases of the patient doesn't want to, so does not want to retain the sexual function. Now we'll move on to the bonus questions. So these bonus questions, you can answer it in the comments. So the first question we want to ask is, in case of pregnancy or in case of the postnatal period, so in such cases, what is the treatment? The second question is, greater than 40 years and with a completed family, with presence of a completed family, what will be the treatment?